I'm Jerry Hesch, a physical therapist in Aurora, Colorado at Hesch Institute. And my client Jay presents with very limited hip extension. So he's lying on his stomach, and when I try and lift that thigh up, it comes up, I would say, less than 5 degrees. And that is present on both sides, kind of an unusual presentation. Okay? He presents with some asymmetry of the pelvis, which is not subtle. Okay, so the left posterior iliac shelf, which I call that midline structure of the ilium, is lower on the left side. When I try and rotate it forward, I cannot discern any early movement called taking up the slack. It's stuck posterior, so it doesn't rotate forward. You'll notice on this side it's much easier to induce forward rotation. Okay? And when we come underneath the sit bone, after we take up the slack, which happens so quickly, there's no vertical mobility, but there is good mobility on this side, good free mobility. The other thing we notice is I'm going to align the crease of his shorts with his gluteal crease. And so I'm coming medial to the sit bones. And you can see that this right sit bone is much closer to the midline compared to the left. And there is blocked mobility, whether I push each sit bone to the right, or if I push each sit bone to the left with a reasonable amount of force, there's just no mobility there. The other part of this pattern that we found earlier is that his coccyx, the tailbone, is side bent to the left. So this index finger is higher up into his left coccygeal sulcus, a depression. There's more space there because that coccyx has 2 extensions on each side and it's side bent, so there's a deeper sulcus on the left side. So these are the movement impairments that I find with his lower body. And he's also restricted in the upper cervical spine, very limited traction mobility. C1 and C2 appear hyperextended, but I'm not going to show that. We're going to treat these movement deficits, and then I will refilm to demonstrate any changes that we're able to achieve. Thank you.